I'm Dr. Jay Anders, and this is Tell Me Where It Hurts, where we discuss some of the big challenges in health IT and how we can solve them so clinicians can do what they do best, care for patients. I'd like to welcome everyone to another episode of Tell Me Where It Hurts. And before I introduce today's guest, who is quite a leader in the health IT industry, I'm going to tell a little where it hurts a little bit more in the last several months as far as health IT is concerned. A personal story, and I won't be too long telling this. I have a 95-year-old mother-in-law. She's the last person standing on both sides of our family. Went into the hospital with atrial fibrillation and congestive heart failure. Well, the good news is they got her through that, cardio converted her, got her back out of the hospital again, and she was feeling pretty well. She had a follow-up with her primary care physician, who she has been on Eliquis for a very long time, who basically saw her and said, "Oh, your Eliquis dose is wrong." So she increased it without really talking to anyone, just said, "We need to have this." Week after that, she had a visit with her cardiologist. This is the just regular cardiologist, not the electrophysiologist that actually did her cardio version. So there's 3 physicians involved with this. Who saw her and said, "Well, I'm not so sure about that. Let's do some blood work and we'll decide." So let's roll forward here. My wife, who was staying with her and helping her through her last week of convalescence there at home, went to the pharmacy to pick up her drugs. Well, there was a prescription of Eliquis with 2 different dosages, 1 bottle of each. So that not being the case, and since she has an internist in the family, I got a phone call saying, "What do I do with this?"
Right.
And I said, "Well, I'm not her treating physician. However, I would not give her both because that's really kind of what it said. Take both of these twice a day," which would have given her way too much.
Exactly.
I said, "You need to call her doc." Well, she did. No answer for 10 days. So after we finally got through, the electrophysiologist said, "Well, keep her on the lower dose," which is what I thought at the beginning, given her advanced age and her
Exactly.
other medical condition. Um, it was completely frustrating for my wife, who was her caregiver, her sister, who's her other caregiver, and a
Mhm.
complete failure in my mind of any type of interoperability between 2 major EMRs that
Right.
we all know and love, all the names we know and love, that don't communicate with each other and they don't coordinate anything. So
Exactly.
we'll talk a little bit more about this with our guest today, but I'd like to introduce Christopher Kunney. Christopher is a healthcare technology thought leader, and that's kind of understated. A strategist, a managing partner of IOTECH Consulting. He's been a business advisor to many, many companies. I met Chris back when he was working for Juno. He served at the senior vice president level of digital acceleration for Divergent, chief of strategy at Juno, which is a former DSS, senior vice president of healthcare information technology for the Coker Group, which is quite a large consulting group, as people know. He also served as an entrepreneur in residence to the Combine, the director of emerging healthcare technologies for AT&T, vice president and CEO for Health Innovations, vice president and CIO of Piedmont Healthcare. He has basically done it all. So I'm really happy to have him today to discuss several things, including the thing I just talked about with Chris. Chris, welcome to the program.
Thank you so much, Dr. Anders. It's such a pleasure and honor to be a part of, this episode of your podcast. And as we were preparing for this event, you kind of reminded me of when we actually met, which was, several cycles ago in my journey as well too. So it's nice to see things come full circle. And I'm excited to have this conversation too. And I hope your mother-in-law is doing well, and there lies obviously some of the challenges and opportunities that still exist within our healthcare ecosystem, and how technology can either exacerbate the problem or solve the issue if applied and leveraged correctly. So I look forward to having that discussion in greater detail.
So, Chris, you have been, like I said, you've done about everything.
I've been around a while.
So, yes, could you tell us a little bit about your journey of like how you got started and how you got to where you are today?
Sure. Yeah. My journey is people ask a lot, well, how did you, get into what you're getting, into healthcare IT? And honestly, it wasn't necessarily a conscious decision per se, but a culmination of kind of an entire career in technology in general. So my background at its core has always been in technology. My degrees in computer science, my master's in the management of technology. And I started my career early on thinking I wanted to be what we call back in the day a programmer. So I'm aging myself as well. I started as a programmer in the late 80s, actually working for a company, interesting enough, that was developing software in the healthcare market. Actually didn't really realize it at the time when I was there, but that's exactly what we were doing. It's a company called Gerber Alley. We were building financial systems for healthcare, and then it got acquired by HBO that ultimately got acquired by McKesson. And
Yes.
so early in my career, I was actually developing software as a programmer, that we call them developers now, in that space. Fast forward a couple of years, I ended up working for a company called Hewlett Packard, and spent about a decade there in a wide variety of roles, including a systems engineer, quality manager, led teams of support staff, ultimately became a director there as well. Moved from there to a smaller company, their CIO at that time, and was leading their support team and their infrastructure around that product line. Back then, I actually uh, caught the dot-com bubble. A friend and I actually purchased a software development company, and we were building websites, e-commerce websites back in the day as well too, and got a chance to be an entrepreneur within that space. Unfortunately, I missed the mark a little bit too late. We got into that industry a little bit too late, and the bubble burst, the recession hit, and we had to go find new jobs. And one of my new jobs was actually teaching. I was an adjunct professor for a local university, and I was teaching a myriad of classes, and one of them was around strategic thinking and problem solving. And I was lecturing to my class about looking at industry trends and getting in front of those trends and riding the momentum of those trends. And hey, there's this industry, healthcare, and specifically healthcare technology, is a trend you might want to start taking a look at. There's going to be a tremendous amount of growth. They're starting to launch these things called EHRs that are going to really transform the industry. And so one day I was shaving and brushing my teeth or something. I look at myself in the mirror and said, why aren't you getting into this industry? You're encouraging everyone else to do it. And so I made a conscious decision to start pursuing opportunities there. I was real fortunate that a local health system had an opening in their IT department for a manager to manage their help desk and data center operations. I took that, I was able to secure that job. And through a myriad of promotions, I became a director there and ultimately the CIO for that health system as well too. And so that gave me an opportunity to take a more strategic view around technology and to help that health system start to transform in the adoption of things like electronic health record systems and telemedicine solutions, et cetera. And then I moved over to the dark side and became a consultant. Started working, started working as an advisor and a consulting for a number of different companies. Some of them you mentioned, organizations like AT&T and others, and I got recruited by AT&T to serve as their executive director of emerging healthcare technology and help them launch that practice. And then was getting requests from various other companies to do similar type of work. So I launched my own consulting practice, which was IOTECH Consulting, and then began working with various hospital systems and technology companies, academic institutions, government agencies, having technology transformation through that ecosystem. And that's where you met me at one point in time working for a company called VSS, and we launched a product called Juno Health, or Juno EHR, and then ultimately a suite of products called Juno Health. And have since then just been a part of this industry and watching and observing and participating in the transformation of healthcare through the use of information technology. So it's been an amazing journey, and I've been really fortunate to both be on the provider side the academic side and the vendor side. And it's again been a pleasure and an honor to be a part of an industry that has such an impact on everyone's life, and more importantly, how technology can be a differentiator in that space.
I say that a lot to colleagues who ask me, well, why'd you get into this business as opposed to being a practicing internist? And I said, well,
Right,
I've said this before on prior podcasts to a lot of people, and in my practice, it was 6,000 patient visits a year.
right.
In this business, you can impact the lives of hundreds of thousands of people if you do it right.
That's
So
correct.
I can understand that motivation very well. So like you
Absolutely.
said, you've been on both sides of this. You've been on the
Yes, I
user
have.
side, you've been on the actually creation side, and you've been on the consulting side. As you look back over the last 5, 10 years,
Yes.
what do you think the biggest challenges have been, and where do you think we're still grappling, other than the fact we just talked about one earlier in the
Right. Well,
conversation?
I tell you, that's a loaded question, and we could probably spend the entire podcast just having a conversation on the myriad of areas. I think that there's still growth and opportunities for us to address. And the very first one is the one that you had led with, and that's this whole issue around interoperability and data silos. I mean, that despite the fact that we've seen improvements in that space, and we've seen the consolidation of technologies and the improvement in sharing data amongst some systems, there still is a lot of gaps in that space. It's still a major challenge. Health systems and providers and payers still often use very disparate systems today that don't communicate effectively, which leads to fragmented care. And that fragmentation, impacts operational efficiencies. It continues to drive cost up in the healthcare system, and ultimately compromises patient care, which you gave a great example of your mother-in-law, the fact that that data hadn't been shared with the right care team or broader set of the care team so that they can make a more holistic decision about the type of treatment she should be receiving post her discharge as well. Cybersecurity, is an issue that continues to be on the forefront of healthcare, and we continue to be challenged with how to protect and secure patient information. We see every day, latest cyber attack, which includes things like ransomware and data breaches and phishing attacks. Internal, and external bad actors, getting access to patient data. And this obviously has a huge impact on, data operations and patient care, and most importantly, erodes the trust of the healthcare systems as well. Regulatory compliance, as we continue to adopt these technologies, and healthcare is one of the most highly regulated industries today. As we continue to use technology, there's even more and more regulations now health systems have to keep in mind of. So whether it's things like HIPAA or GDPR or SOX, or you name your myriad of alphabet soup of compliance or requirements, healthcare continues to be challenged there, and that continues to be a challenge for hospital leaders. So how do we maintain and meet these requirement standards with the limited amount of dollars and resources and people that we have at our disposal? EHR usability. I mean, again, we've seen this evolution of electronic health records. You talked a lot about that on my podcast that you were on as well too, and you've seen that evolution happen from moving from really billing systems to now clinical tools that hospitals and health providers are using. But there still are issues around usability. We still see these systems impact and create a negative cognitive workload on the clinicians. How do we continue to make those systems more efficient, more intuitive, reduce error rates associated with that, and be a productive resource to the clinician and healthcare provider in delivering that care? And then also on the operations side, provide solid insights and information that helps us manage the business more efficiently and more effectively.
Well, interestingly, you kind
Yeah,
of bring that up for a minute. There's been an
sure.
interesting statistic that I read recently where, Teffa came on board. Mickey Tripathi's done a great job, I think, as an ONC, getting
Exactly.
interoperability standards out there and starting to get their hands around AI and some of this other stuff.
Sure.
But the statistic I read that 75% of clinicians who do receive interoperability information data from one to another
Right.
don't use it.
Right.
They don't access it or they don't use it. I
Exactly.
found that fascinating. Why
Yeah.
do you think that is?
Well, I think it's a couple of reasons why. One, although they have access to massive amounts of information, that information isn't aggregated or consolidated in a way that helps them make more effective decisions. And so now they've got to go out and search the data, digest the data, and then somehow leverage this data in a way that can help them make better clinical decisions. And they just don't, a lot of times, have the time or luxury to do that because that data is still fragmented in a lot of ways. It hasn't been aggregated or consolidated and then delivered in a way that provides advice to the clinician without the clinician having to go out and do the extra effort to consolidate that information and make meaningful insights on it. So I still think that we've got a lot of opportunities to leverage tools like AI, machine learning, and reporting tools to help the clinician take these massive amounts of information and aggregate them in a way that really provides value to them and so that they can use it to make better clinical decisions. I think is one of the biggest challenges because, again, they only have a finite amount of time to see that patient, and they have to take whatever information they can get through their own observations and the limited amount of information they have time to digest through the tools to make clinical decisions for those patients. And I just think that there's still a lot of challenges and opportunities there.
Well, I'm glad for the transition because you brought it up. You do a lot of strategy for
Yes.
organizations.
Mm-hmm.
And we all in this industry are inundated now with AI, generative or otherwise,
Yes.
how it's going to be incorporated into healthcare, ambient listening technologies. And I just looked
Exactly.
at it just the other day, did a search, and I found 73 companies
Yes,
that
there
are
is.
doing ambient listening, creating more
Right.
text
Right.
that really isn't coded, really can't be transmitted yet. So it's kind of changed and taken over the conversation. So I'd like your opinion and insight on what do you think is going to happen here when it comes to incorporating some of this new technology. Some of it is very intriguing and I think very useful. But I also have that bit of me that's been practicing medicine for 25 years going,
Right.
let's take a pause.
Absolutely. Well, I think first and foremost, we have to recognize that we're at the very beginning phases of, the potential that these technologies will offer for us. And so we can't be too hypercritical about it today because it's still very much a very emerging group of technologies, whether it's facial recognition, whether it's imaging analysis, whether it's ambient voice technologies, whether it's machine learning, generative AI, et cetera. We're still at the very early stages of the maturity of these technologies. So we have to be we have to be patient but vigilant about how we apply them in the healthcare setting. I'm very excited about the potential, that being said, of where these technologies will ultimately advance. Because I do think that they will be a value-added resource to the provider in helping them make better decisions, and more accurate decisions, and decisions based on a wide variety of curated data that has a high level of efficacy built behind that to help support their overall decision-making and the delivery of care. That being said, we still have to be very cautious about where we apply it today. And we still have to understand that these technologies can only be effective based on the efficacy of the data that it is digesting and curating. And so we have to make sure that we have to put systems behind it or governance systems behind these tools to make sure that the data that they are leveraging are accurate, complete, we address issues around biases and disparities within the data itself so that when these tools are applied to develop intelligence out of the information that it is curating, it has that higher level of efficacy than a human being could deliver on their own. And so we always have to have that measuring stick there too. Can a human being provide better insights than what these tools and technologies are generating for us today. If they can, then we should always rely on the human being as the de facto, decision maker. But if we can show that these technologies in some cases or many cases provide a higher level of accuracy, completeness, or efficacy, then we would do ourselves an injustice not to find ways to leverage it in our clinical delivery processes as well. But this is a journey. It's not a destination. So we can't say just because today the technology doesn't 100% meet all the requirements that we would want, 100% accuracy in the data. The data, it can only be as accurate as the data that is being presented. And who's creating the data? Well, it's human beings, right? And so human beings have to be held accountable for making sure that the data that these tools are leveraging have a high level of accuracy and efficacy, and and we need to be ever vigilant about biases that are built into these systems as well.
Well, I was very happy to see the ONC step in with HTI-1, now about to be HTI-2.
Exactly.
And I had an opportunity to talk to the person that actually wrote the regulation, which was very insightful.
Mm-hmm.
But it was interesting to me to know that at least someone has decided that we need to put a little bracket around this to say exactly what you said, meaning there has to be where the data come from.
That's right.
Was it reliable to begin with?
Exactly.
How do we determine that? And then how do we use it? One of the things that has bothered me a little is I see all these companies saying we're going to incorporate AI. That's just kind of a thing everybody says. However, when it comes down to the provision of care, I don't see a lot of folks asking the provider of that care, what can we help you with? What is it we can give you or help you with to make be more accurate, more productive, better patient care? Right. Talk about that just a little bit, because you were talking a little bit about bias. Oh, absolutely. That's one of the things was my soapbox for a long time.
Exactly. And I'm a firm believer in kind of the three-pronged stool: people, process, and technology. So the technology is not the magic bullet. It's not going to solve every problem that you have unless you have the right type of processes in place, the right type of people who are trained. And then there's probably a fourth leg to that stool, and then data that is being leveraged that these technologies are leveraging in order to ensure you meet the goals and requirements that improve the quality of care for the patients that you're responsible for. And so I think governmental agencies do have a responsibility to help set standards around that efficacy of that data, on how it's going to be leveraged. What criteria do we want to collect this information when we use this data in a way that prepares, especially if we're going to also leverage things like generative AI. So the fact that HTI-1 is out and now HTI-2 is currently being evaluated. That's the foundational components, I think, from a regulatory standpoint, that will help to set some standards around that, just like we did with having certified electronic health records. That weeded out a lot of EHR companies that existed before, right? Remember, prior to that, there were hundreds of EHR companies out there, but by the time they had to meet those requirements, it whittled it down to a very small, finite number of companies that could meet those standards. And now ultimately, you fast forward today, you've got roughly 3 to 5, EHR companies that dominate the market today. That's because, again, many of these companies could not meet those standards, couldn't make the investment in that, or healthcare systems decided to choose, the best breed of solutions that were in the marketplace today. And I think you'll start to see that more with these technologies as well, as these standards continue to become more refined, and we apply those to, the use of AI. We'll start to see these companies either meet the cut, or they'll die on the vine. And the ones that do will continue to emerge as the ones that become a very standard technology or standard platforms that healthcare organizations will use. Because one thing we do know about healthcare, and here's what I always say: healthcare has what I call kind of a herd mentality or a bird mentality. If one healthcare system is using a technology, most likely another one's going to use it. Another one's going to use it because it's been validated by another one. And before you know, they're all using the same basic technologies. because it's been vetted and it's met the needs of their counterparts. And I think you'll start to see that happen within this whole AI arena as well too. Right now, it's very much kind of the wild, wild west. But like the wild, wild west, it does get tamed, over time. We just have to be, again, patient and vigilant as we go through that process. And then we do have to have that relationship with our federal agencies to help set those standards. And then we have to build these coalitions amongst technology delivery partners to also hold themselves accountable for the efficacy of the data as well.
So when you're doing your consulting, what are the big stress factors you're seeing at the EHR provider level, the provider level? Are we worried about the right things? What do you see as one of the biggest angst that's being presented out there in healthcare, especially healthcare IT?
Yeah, and we talked about a few of them already as well. First of all, this whole concept of health data management, just the complexity that exists behind the sheer volume of data that health systems are now trying to get their arms around. I mean, there's this whole concept of, what we call big data, and then there's the kind of the subset of that, and that's deep data. I mean, health systems have a bunch of data, a lot of information, but how much of that data is actually intelligence? Is providing insights? Have we been able to drill into it and correlate that data in a way that both providers can make better decisions about clinical decisions about their patients, or healthcare leaders can make better business decisions about the operations of their healthcare systems as well too? And there lies the challenge we have right now with all this data that we're collecting. The accuracy of it, the efficacy of it, the biases that still inherent biases that exist in that, and then the tools that we can then invest in to give us those real meaningful insights are still areas of opportunity and challenges. And not only that, the resources needed to do that analysis as well too. That we're still challenged with having enough health informaticists in the marketplace. That's an emerging kind of role that we were starting to see happen within the healthcare ecosystem, and we don't have enough of those people who can step in and do that type of work on behalf of healthcare systems. So I think that's still a big area of opportunity for our industry, and we need to double down on investing and building a pipeline of professionals in that space. The other thing I think that's happening is, and we talked about it earlier, is the cognitive workload. And so I've got to find ways and tools that are more intuitive, easier to use, easier to adopt, flexible enough that it doesn't create more burden and more work on the healthcare leader or provider to do their job effectively. And so the promise of things like AI and ambient voice technologies and others that will reduce that cognitive workload are very promising, but we still have a long way to go to see, the full adoption and robustness of those technologies. And then I think patient data ownership. Patients are now demanding to own their data, to have control of that data as well. How can healthcare systems meet that demand and that request, but ensure that they protect the continuity of the patient record itself, because that is the legal document, and they're going to be held accountable for that. And so, but patients still want access to it, and they still want to be able to incorporate other information that they're collecting on their own through their wearable devices and other tools that they can use to have some impact on their healthcare. We've got to figure out how the best ways to manage that data in a way that we don't affect the integrity of the core clinical record, but we still maintain the need for the patient to have control and access of that information. And then, healthcare systems post-COVID are still challenged with the financial aspect of healthcare. They're still trying to get their arms around capturing more revenue, driving more costs out of their operations, finding new lines of business to go after, deal with the competitive nature of healthcare today, and finding those lines of business that are most profitable. And despite that many healthcare systems are not for profit, you still have to have the resources to meet the mission and goal of those healthcare systems. So no money, no mission. And so healthcare systems continue to be challenged with this whole concept of value-based care versus fee-for-service care. Our entire ecosystem is based on a fee-for-service model, has been for since its inception for the most part. How do we now move away from that and create a value-based care model that is a sustainable, profitable model for healthcare systems who have, don't operate in a model like that today. And the ecosystem, quite honestly, doesn't really support it. And so there's challenges there and opportunities for us to figure out how we do that. But also we want to make sure that we don't, invest in technologies that are going to fall flat on their face and ultimately create dissatisfaction and concern in the use of it, because they are emerging. And so we have to be very cautious and careful about where we apply these technologies and make sure that when we do apply, we can get some successes and wins behind it so that we can continue to advance the adoption. Because as soon as these technologies start to fail and we start to see, cracks in healthcare systems and doctors and clinicians are going to push back and say, no, I'm not going to use that. I'm not comfortable with it.
Absolutely.
And I'm not going to adopt it. And so we don't want that to happen. For example, you look at things like blockchain. We've been talking about blockchain for how long, but yet how many meaningful technologies have been adopted in healthcare using blockchain today? We still have a long way to go there. And now AI is kind of this next evolution of technologies that we have to be very cautious, but define the successes and wins behind how we use them and make sure that all the constituents are involved in the evolution of these technologies. And then I think finally, this whole concept, and we talked about it before, interoperability. We've got to find ways to be able to share data. And in my mind, it's not really a technology issue. You look at other industries that have the ability to share all sorts of complicated data amongst themselves to make their businesses more efficient and more knowledgeable, not because necessarily it's a technology issue, but because in some cases, some of our major vendors aren't, all that enthused about wanting to share data with their competition. Some providers aren't willing to want to share that data with their competition. And, our regulatory rules are not really holding them accountable, quite honestly, to making that a reality sooner than later. So I do think there's a lot of opportunity there for us to get all in the same boat and talk about why are we in this industry? Well, we're in this industry to provide better care for patients. And if we all work together towards that and we create a model that supports that, we can all be successful with it. There doesn't have to be this kind of win-lose scenario. In order for me to win, I have to protect all my data. You can't get access to it. In order for the vendor to win, you can't get access to my data. I'm going to make it difficult for innovation to happen on top of my technology, which you see a lot of that happening today as well too. We have to be in this boat together. We have to put the patient first and say what's important to in the delivery care. It's about the patient. So we need to be open about how we share data going forward. And so those are just a few things that that kind of resonate with me and with the clients that I'm dealing with today. And then finally, I think there's this whole concept of what I call the silver tsunami. And that's the fact that, every day 10,000 people are turning 65. And by 2050, 1/4 of the world's population will be over 65. So we've got the baby boomers are moving into those senior years. We're going to have this huge wave of people that are going to be impacting the healthcare system. We're not replacing providers as quickly as that are retiring and leaving the healthcare system. How are we going to deal with that tsunami in an effective way so that it doesn't take 10 days for your 90-plus-year-old mother-in-law to get a call back from a clinician? Though that's unacceptable. But it's going to get worse if we don't figure out how to solve that problem as well.
Absolutely.
Yeah.
Well, kind of as we wrap up here, I ask this of everyone. If you had a magic wand and could get one thing done in this industry, what would it be?
Wow, that's a very good question because there's so many pieces that are broken. I think the one thing that it may come as a surprise to some, but the one thing I think that I would like to see happen is that through the evolution and the journey of EHRs, we've now emerged and there's a handful of technology companies that are really dominating that market. What I would like to see is those companies move away from being best of breed technologies to become more open architecture platforms, that allows innovation to happen on top of their platform and not limited or prohibited in some cases, just because they're concerned that somebody's going to build a better mousetrap. you really want them to build a better mousetrap. And because ultimately what you have is what they want, and that is the patient data. And you'll always maintain control and access of that. And if you do a good job at that and allow innovation to happen around you, you will always be the most valuable part of that ecosystem because you manage the patient information. And now you're allowing innovation to happen around that, which will ultimately improve patient care. So I would love to see that happen.
That's a great wish. I think I have that
Yes.
wish as well. Absolutely. So if somebody wants to get in touch with you and talk with you more or engage you, how would they do that?
Sure. If you want to reach me, there's a couple of ways. Obviously, LinkedIn is one. And I accept all LinkedIn requests. Also, you can reach out to me via my website, iotechconsulting.com, or through email, christopher.kunney@iotechconsulting.com.
Thank you very much, Chris.
That's all for today. Thanks for listening to Tell Me Where It Hurts. Tune in to Healthcare Now Radio and Podcast Network each month for the latest episode. To learn more about Medicomp systems, visit our website at www.medicomp.com. You can also follow us on Twitter at MedicompSys or myself at MedicompDoc, or check out the show notes for links. See you next time.